Welcome back. You can call us with your questions on measles. The number to call is 0808 054 2233. That's 0808 054 2233. You can also tweet at CTV_Mary A. You were mentioning just a few moments ago complications. What are complications that could result from measles?
There are several complications. Most important complication, the commonest complication, is otitis media. That's the infection of the ears. So it's very important for the healthcare provider to look into the ears of a child that is having measles. The mother should also be mindful of anything coming out from the ear, or the child having ear pain, so she can take the child to the hospital. Pneumonia is also a very important complication.
Probably because of compromised lungs or something?
Yeah, the viruses have a way of attacking the lungs, but most of the time it's secondary bacterial pneumonia that tends to block the airways. So there are two mechanisms, especially in people who have low immunity. The virus can attack the airway, but the majority of people who are well nourished and they have good immunity, it will be secondary, other bacterial infection. So the healthcare provider needs to be very watchful about development of pneumonia, because that is what causes death most of the time. But what is commonest actually is otitis media, the infection of the ear.
This redness of the eye that happens, does it affect the sight in any way?
It shouldn't affect the sight, but sometimes that's why it's sometimes it could cause long-lasting eye problem, especially in those who are deficient in vitamin A. Vitamin A is very important, and is actually recommended that every child that has measles should be given vitamin A. Yeah, research has shown that many of those who develop measles, and especially those who develop complications, those who are very low on vitamin A levels. Happily, in Nigeria, we're having supplementation of most of our food.
Oh yes, there is supplementation of vitamin A, which is really good.
So we don't expect, mostly the eyes will recover. It's just a kind of conjunctivitis.
Okay. Not blindness or anything like that.
No. But because vitamin A deficiency can lead to a problem with the eyes that would cause damage to the cornea, to the parts of the eye. Okay. So that vitamin A supplementation is very, very important.
Now, when somebody has measles and recovers, is he expected, can he expect, of course he wouldn't want to have measles again anytime in his life?
If you've had measles, it's unlikely that you're going to have measles again. But in some situations it can happen, especially if you didn't develop appropriate immunity. But what happens is that they would have likely milder forms. So even if a child had measles, it's expected that the child should be given measles vaccine. Again, sometimes we would say a child has had measles and it wasn't measles, because there are several other rashes that are associated with febrile illnesses that are not measles. So if the child had a confirmation that it was measles, the child will still need to have vaccination, because he may not have appropriate primary immunity from that infection.
Okay, some of the treatments which you mentioned, or should I say the care which you mentioned, which is supportive, are things that can be done, at home, at least before the child is taken to the hospital if it's so hot. On the way to the hospital, the mom or caregiver can be tepid sponging, reducing the temperature. Are there other things parents can do to help their children go through this as comfortably as possible?
Yes, the thing the parent can do, as you say, first of all, the mother needs to be the parent, even fathers also.
Even fathers.
Everybody. So they have to be observant. If the child is having high-grade fever, the child can have convulsions. So being observant is very important, and controlling that temperature. Because the good thing about measles is that in a majority of cases there will be no complication, and it will run a predictable course. That you can say in 10 days this child is going to, he should have recovered, unless there are complications. So the mother needs to make sure that the temperature is controlled, so this child doesn't go into having convulsions.
Yeah.
Because with high-grade fever, the child can develop convulsions. Okay, and then the issue of the use of paracetamol also. Paracetamol is an over-the-counter medication, so it doesn't need a prescription. So you need to get paracetamol. You can give it to the child. So then, in terms of, some people get some other over-the-counter medications, but many of those medications are not. They are not believed to be effective. Actually, even when you get to the hospital, what the doctor is likely to do is to look at this child and confirm your diagnosis clinically. And then, if the child requires any extra treatment apart from the viral infection, that will be done. For instance, if there is bacterial infection, that will be done. But mostly, there is no indication for use of any specific treatment in that child. So the child needs just temperature control, make the child comfortable by giving things that reduce itching, and then give a lot of fluid and help the child to feed. If the child is having diarrhea, you need to put the child on zinc. You can give the child vitamin A. There are several things that the healthcare provider needs to do, but giving the child appropriate fluid and suiting the child.
What if the child is vomiting? Do they sometimes throw up?
Yeah, they can throw up.
So you can't get any fluids into them?
If the child is throwing up and you can't get fluid into them, you have to take the child to the hospital.
Good advice. Now, with all this massive, you saw the figures, with all this massive reduction, because that is so significant, 79% between 2000 and 2015, what is lacking really? Why haven't we just stamped it out completely? Because it looks like it's a very effective, I mean, if this is one of the SDGs, we're doing very well.
The problem with measles vaccination is still the problem with general vaccination, the issue of acceptability. For instance,
acceptability.
In the case of, in Sokoto State, for instance, what happened was that the communities affected refused to have vaccination for up to 3 years.
Oh.
And then access, the issue of affordability. You give them one shot, 87% get covered. What happens to the 13%? And again, some communities, new communities are evolving around our urban cities. For instance, in the case of Lagos, what happened was that those people is a kind of a new community around the Ikate area of Lagos, and then they were not vaccinated.
Okay.
And they came down with it. So access to vaccine by improving the ability of patients, the populace to be vaccinated without having to pay for it.
Okay.
And reaching the unreached people. For instance, in Borno State,
yes,
it's difficult to even know those, because we have not had as much reports there. But your guess is as good as mine, what could be happening in those areas.
Okay.
So people need to be vaccinated, because the risk of having measles without being vaccinated is almost 100%.
All right, on that note, we have to close. Thanks for being with us and listening in. Have a great day. I am Mary Alale Yusuf.